लार्जली प्रिवेंटेबल है, क्योंकि उन्होंने फोकस टॉपिक दिया है मेरे को कि हृदय रोग के बारे में बोला जाए। तो लेट मी स्टार्ट विद दैट। तो इसमें कोई दो राय नहीं है कि हार्ट डिजीज नंबर 1 कॉज ऑफ मॉर्टेलिटी सारे वर्ल्ड में। आप कितने भी कैंसर्स ले लें, कितनी भी और चीज़ें ले लें, उनको सबको कंबाइन अगर कर देंगे, स्टिल नंबर 1 किलर इज हार्ट अटैक्स, हार्ट डिजीज ऑफ एनी काइंड। तो स्टेप बाय स्टेप आज आपसे मैं डिस्कस करूँगा। बड़ी सिंपल चीज़ है कि ये कितना बड़ा प्रॉब्लम है, ये तो मैं बता ही रहा हूँ कि भाई ये नंबर 1 कॉज ऑफ डेथ है। और अपने यहाँ कि जहाँ वेस्ट के अंदर ये डिजीज़ होती है 60, 70, 80 और उन डिकेड्स में, हमारे यहाँ 30 और 40 की उम्र में होगी, ये बड़ी डिफरेंस है। और यही कारण है कि मैंने जब अंकिता जी ने बोला कि मैंने कहा कि आप लोगों के पास इतनी पावर है प्रेस के पास कि ये लोगों को उजागर कर सकते हैं कि कैसे हमारे देश में और क्यों हमारे देश में 30, 35, 40 साल के लोगों को हृदयघात हो रहा है, सडन कार्डियक डेथ्स हो रही है, और क्या इन यंग लोगों को बचाया जा सकता है? यही नहीं चीज़। नंबर 2 चीज़ ये है कि भाई इसके रिस्क फैक्टर्स क्या हैं, हम समझें कि ये है क्या। हर किसी की डेथ होती है, कहते जी हार्ट अटैक हो गया। कार्डियक अरेस्ट इज नॉट हार्ट अटैक। हाँ, हार्ट अटैक के अंदर कार्डियक अरेस्ट हो सकता है। दूसरा, क्या हम इसको प्रिडिक्ट कर सकते हैं, क्या प्रिवेंट कर सकते हैं, क्या हमारी की मैसेजेस हैं? सो अगर आप ये देखें कि इंडिया के अंदर भी कॉरोनरी आर्टरी डिजीज क्या है? कॉरोनरी आर्टरी डिजीज वो डिजीज है कि हार्ट की जो धमनियां हैं उनके अंदर ब्लॉकेज हो गया था, कॉरोनरी आर्टरी डिजीज। और कॉरोनरी आर्टरी डिजीज नंबर 1 कॉज है। 7 गुना अर्बन में, 4 इन रूरल एरिया में, और 2013 से डेटा है, आज तक बढ़ती ही जा रही है। लोग पूछते हैं कि व्हाट अबाउट द यंग पीपल, व्हाट अबाउट यंग इंडिया? ये आज की मीटिंग है सिर्फ इसीलिए कि यंग इंडिया के अंदर ये अत्यधिक कॉमन होती जा रही है। और कितनी बार आपने सुना है कि वो गए थे, वो तो जिम कर रहे थे, बहुत अच्छा काम कर रहे थे, लेकिन वो जिम से फिर उठे ही नहीं। ये बड़ा इम्पोर्टेंट पॉइंट ऑफ डिस्कशन है। तो इसके सबसे पहले कमिंग टू डिजीज इटसेल्फ, इसके रिस्क फैक्टर्स क्या है? हो सकते हैं फैमिली हिस्ट्री अगर है तो हार्ट अटैक हो सकते हैं, हाई ब्लड प्रेशर, डायबिटीज, हाई कोलेस्ट्रॉल, स्मोकिंग या निकोटीन किसी भी रूप में। और अब तीन चीजें जो ऐड हो गई, ये पहले ये क्लासिकल रिस्क फैक्टर्स थे, अब जो चीजें ऐड हुई है वो है ओबेसिटी, फिजिकल इनएक्टिविटी और साइकोसोशल स्ट्रेस। एवरीबॉडी इज अंडर स्ट्रेस। जब अपना बच्चा भी जाता है क्लास 12 के एग्जाम में, वो भी टेंशन में होता है कि यार मेरे को 90% नहीं आया तो मेरे को आगे नीट में एग्जाम नहीं दे पाऊंगा। ये रिस्क फैक्टर्स हैं। और इसके अंदर एक इम्पोर्टेंट रिस्क फैक्टर जो अब जुड़ा है वो है स्लीप, डीरेंज्ड स्लीप एपनिया। तो ये सारे रिस्क फैक्टर्स हैं जो कि मैंने कहा लोगों के साथ में जरूर डिस्कस करूंगा, क्योंकि डिजीज ऐसे ही नहीं हो जाती, कारण जरूर कोई ना कोई, सडन कुछ नहीं होता। हाई ब्लड प्रेशर बहुत ही कॉमन है, with 40% of those over 25 having high blood pressure. 1.8 billion population, 7.5 billion population है वर्ल्ड में, 1.4 billion लोगों people have got high blood pressure, और high blood pressure one of the commonest causes of blockages in the arteries of the heart, arteries of the brain, arteries of the extremities. So it can cause heart attacks, it can cause strokes, it can cause peripheral vascular disease. Diabetes और समझ लो ये खाता हूँ यार क्या हो गया इट मैटर्स। सिर्फ एक मैं आपको साइंटिफिक डेटा बताऊंगा, बाकी एक्सपीरियंस वाली बात है कि अगर आपका बैड कोलेस्ट्रॉल इज बिटवीन 50 to 70, if it goes between 70 to 110, हार्ट अटैक में वैस्कुलर डिजीज अपना तो देखते भी नहीं उसको, भी बहुत बड़े until unless it goes up. So hyperdyslipidemia as it is called, high cholesterol levels are extremely important. Now we find that even in children, people over 20, men over 20, women over 25, very, very common and very overlooked. If the cholesterol levels are between 140 to 150, they have 3 vascular sites are involved. That is the importance of having high cholesterol levels. And it is not only high cholesterol levels that matters, it also matters for how many years you have not taken care of it. So LDL levels matter, LDL years matter. If it starts early in life, you are going to have a problem seriously. So prolonged exposure to lower LDL cholesterol early in life is associated with substantially greater reduction in the risk of disease. So the higher it is, the more the chances are. Smoking kills more people each year than alcohol, cocaine, crack, heroin, homicide, car accidents, fire, AIDS, all combined. So if somebody is diabetic, he has high blood pressure, he has high cholesterol, and on top of that is also a smoker, then you will see why would he not have a disease? And one factor which I have not factored in is atmospheric pollution. Pollution also causes huge damage to the human heart, to the human brain, to the human extremities. Family history is very important. If there is genetic history of heart attacks, then you have fairly high chances of getting heart attacks yourself. It is called a polygenic risk score. And that risk score can define, even in your small child, that yes, he has a chance of getting heart attacks. Now it works like this, that in the West, this disease starts at 50 or 60 years. In ours, it starts at 35, 40. And if your father had it, then you will have it a decade earlier. So genetic history, family history, all these are extremely important. But read the last paragraph. That family history also refers to shared factors. That in a family, everybody is eating the same thing. Most people are not exercising. Most people are couch potatoes. That is also family history, which may not be in the genes, but it is in the environment. That also causes dietary intake, physical inactivity, sedentary lifestyle, all tend to be similar within families. And you will see some of these families that have increased levels of heart attacks. So, with this in mind, let me say
The heart is a muscle about the size of a closed fist. A normal adult heart usually beats about 60 to 100 times per minute. With each beat, your heart pushes blood throughout your body. This illustration shows a cross-sectional view.
So, this organ, which even if you're lying on the beach and you are totally relaxed, is supplied by these 3 arteries. It is a muscle. It needs blood supply. And if it has to beat 70 times per minute, if there is any blockage in any one of them, you will get a heart attack. If there are blockages in all of them, you might suddenly the heart may just stop beating. So, heart also needs energy, and the energy is provided by these 3 arteries.
Like all muscles in your body, the heart needs oxygen to live and work. Special blood vessels on the surface of your heart, called coronary arteries, deliver oxygen to your heart muscle. Plaque can build up in the coronary arteries. If the plaque ruptures, a blood clot can form, blocking blood flow. When too little oxygen reaches the heart muscle, the muscle tissue dies. This is called a heart attack. The damage.
So this is the heart. This can suddenly you are smoking or you are exercising, which you are not used to, and suddenly the plaque ruptures, and with that you fall down immediately. So, therefore, this is called coronary artery disease. Why? Because it is specifically, and coronary artery disease can lead to a heart attack, myocardial infarction. So if our press is educated, they can write, look, when we went, the patient was on the floor. We don't know whether it was actually heart attack post like it was, or it was a rhythm disturbance, or it was a cardiomyopathy, what happened. But this is what you can see very clearly. We have opened the artery in one way, and you can see cholesterol into the plaque. And when this ruptures, you get a heart attack. All heart attacks, this mission Save Heart that we started back in our previous institution was based on this. That if sudden heart attack has taken place, within 1 hour is the time either the patient is already no longer there, he is needing CPR, or mission Save Heart, within 1 hour if this patient reaches a good institution, a hospital, he can get not trusted drug, or we can take him to the cath lab and open his artery. That is the reason why which we thought that Guwahati, Assam needs institutions like this, wherein there is 24/7 availability of the cath lab and staff, that these arteries can be opened. But that is not the only thing that it is meant for. What is it? Now, many people say, sir, I was getting in China. Well, if the blockage is about 70%, 40%, you will get this. Even if you have experienced this is the time to come to the doctor and say, look, when I walk 3 kilometers, I get. So then, without getting a heart attack, they can save you. They can give you drugs for reversal. They can define what it is, and you may then not get a heart attack. But if you do get a heart attack, what are the common symptoms? Many times, the first sign is very important. Indigestion. सर मैं तो कहता हूँ और मेरा पहला हिस्ट्री नॉर्मल था, मुझे डॉक्टर साहब ने कहा कि इसे ठीक है तो आपको गैस, and then he dies within 2 hours because many symptoms can be because of mimic indigestion. Location, this pain is generally in the center. It can go to both the arms. It can go to your mouth area. You can sweat. Generally, the only reason I'm showing this slide is because diabetic patients, so common in our country, 40% of diabetic patients will actually may not have the classical symptoms, but may just have sweating. Or a feeling of impending doom. Anger is a medical term that I may not make it for. Wherein the people in the office say, yeah, but you are sitting down comfortably, you are just sweating, we'll take care of it. No, something bad is going to happen. So all signs of an impending heart attack. Sweating. Now when a person sweats and he's diabetic, he says, blood sugar कहीं sugar low तो नहीं होगी, वो भी हो सकता है. But one of the things can be a heart attack which can be stable, the patient gets. Sudden death is the first clinical manifestation of coronary artery disease. 25% of people will not get an opportunity to tell their colleagues that, look, can you do something for me? I'm already on the floor. Can you help me? 25%. So we've already lost those 25%. That is the value of early detection, early control of factors, early lifestyle management, and cure. So this is the concept of golden hour. Maximum damage to the heart muscle takes place within the first hour. So our whole traffic system, our ambulance system, our hospitals will have to be geared to that the patient can come in just like that and get the test done. So the usual reasons of delay is that, look, I don't think it is heart, maybe it is just gas or lack of awareness, and this is the biggest contribution to press, fabulous press who write so nicely all over that you have to make people know that in our country, in South Asia,